Every year, an estimated 18 million Americans report having shoulder pain. Many of those cases are the result of a rotator cuff tear, which can actually happen even if you don't have an injury. In our HealthCast today, we're looking closely at how it happens and ways to manage the tear without having surgery. About 10 years ago, Jerry Wexler noticed a pain in his left shoulder, which over time got progressively worse.
And that's when I had an MRI done and discovered that it was a tear.
Sports medicine specialist Dr. Jorge Gonzalez says rotator cuff tears are very common, especially as we get older.
After we turn the age of 60, over 20% of the general population are just walking around with some form of rotator cuff tears.
The rotator cuff is actually a group of 4 tendons that are part of the connection of muscles to the bone.
These are the group of muscles that allow us to move our shoulders, reach overhead, and are the main muscle complex that allow us to do most of our functions with our shoulders.
While many never experience pain, for those who do, Dr. Gonzalez takes a conservative treatment approach to ease the discomfort without invasive surgery.
And a lot of that is going to be with medication, activity modification, a good physical therapy protocol where we work extensively on the other muscles and strengthening the portion of the muscle that's not torn. A lot of the time allow our patients to get back to functionality.
Has your lifestyle changed a lot because of
After that first MRI on his left shoulder, Jerry learned he also had a tear in his right shoulder. So far, he's been able to avoid surgery, though, by doing physical therapy a few times a year and occasionally taking anti-inflammatories.
managed it? It hasn't affected my lifestyle. I still ride my bike, I still do my walks, and live a normal life with tears in both shoulders.
Well, cortisone injections as well as stem cell therapy can also reduce the pain of degenerative rotator cuff tears. If you have an acute tear, though, the result of a sudden injury or trauma, that will likely require immediate surgery.